Welcome back. Thank you for still being with us. I see your feedback. Cynthia, thank you so much for tuning in. You go on to say that discussion was absolutely amazing. Big up to Fiona for encouraging our girls to join the tech space. Let me see. This is Harry. Thank you for tuning in and retweeting all our feed. We appreciate you all. Glavan, I see Makari, I see Armstrong. Thank you so much for being part of this discussion, as well as Wambui. We do appreciate you also. Keep staying with us. We are not yet done. We want to get started with the next conversation. And remember, the hashtag is Good Morning Kenya on Twitter. At KBC Channel 1, at KBC Channel 1 News is the official station handle. My handle is Jain Wambui. We welcome you to talk with us through this conversation. So right now, we move to the next discussion, and this is all about tuberculosis. Today, being the 24th of March, is World TB Day, and we just want to take stock of ourselves as a country, how far we have come, what needs to be done in order to move to a point where TB is no longer a problem in our country. As it stands, TB is the 5th leading cause of death in our country, and yet it is a treatable and preventable disease. So what more should we do as we celebrate World TB Day? And of course, we are alive to the fact that we have made so much progress over the years. And to help us with this conversation, also joining us via Zoom right now, we have Elizabeth Mweni, who is the head of TB programs under the Nairobi Metropolitan Services. Good morning, Elizabeth. How are you doing?
I'm fine. Good morning.
Thank you for being with us today. We appreciate you for making time.
I'm happy to be here too.
All right. Now, maybe we could start by understanding, the situation as it currently stands here in our country. When it comes to this conversation about TB, how are we faring?
Okay, we are faring well, but we are still missing a lot of TB cases as per prevalence survey that we did in 2016. We are missing 40% of the TB cases in the community. Yes. And our annual estimate was around 140,000 TB cases. That was in 2019. But we didn't manage to get all that. We were able at least to notify 86,000 TB cases in Kenya. And Nairobi, we were able to notify around 12,000 TB cases. So we are missing a lot of TB cases in the community, and the pandemic on COVID has also worsened the situation because the presentation of TB and COVID is similar. So patients are not coming to the facilities, are also scared of this pandemic, thinking that could be COVID. Yes.
All right. Now, before we even get to the COVID, but because we understand COVID-19 did just, it is a problem that we need to accept that, in terms of the progress that we've made as a country. But looking at the pre-COVID times, what are some of those challenges that we were dealing with? And maybe you could talk a bit about Nairobi County when it comes to the fight against TB. What were those challenges?
Okay, the challenges that we are having is the population. And Nairobi is overpopulated with the small square kilometer that we are having. We have a lot of people that are congested in Nairobi, and we are having high burden of TB in Nairobi. I can say Nairobi is one of the 5 high burden TB counties in Kenya. We contribute to around 15 to 20% of the TB cases that are notified in Kenya every year. Some of the challenges that we are having is the mobile population. We have the street families that are there. Sometimes they have TB. We don't know how best we are going to get them because they move from one place to another. We also have the issue of people who inject drugs. It has been a challenge to us to be able at least to get them on a daily basis so that they can get medication. Nutritional support. TB, when you get TB, you really go down. You become malnourished because it's a chronic disease. So you find most people that are coming with TB are malnourished. They need support. They need nutritional support to be able, at least as you're taking your medication, you'll be able at least even to move up with your nutritional supplement. So challenges is the key population that we have for TB in Nairobi are different from the normal population. The nutrition, we had issues with the nutritional support that has been a challenge, but currently through support of the Global Fund, we are getting support of nutritional support for our patients who are malnourished and they have TB. Yeah.
So in terms of the numbers, it could be worse than what is actually known due to issues to do with awareness about TB. Could that be one of also the problems that was existing pre-COVID?
Yes, awareness and also stigma. I can say TB is still stigmatized. We are getting people thinking that when you have TB, you are more likely to have HIV. So stigma has really done us very bad for TB, because most people think when you have TB, you have HIV, which is not the case, because the population that are HIV positive and they have TB, it's below 30%. And I can say in Nairobi, you are 28% of the cases that have TB and HIV are co-infected. So stigma has also done us. Awareness, we have really tried. And I can say during the pandemic, we have our toll-free that we call, and we also have, we are trying to also amplify our self-screening app that can be done on also using your phone. Yeah.
All right. Now, let's talk a bit about, during this time that we have been in this pandemic and still trying to combat TB as, part of the national conversations. Looking at the progress we had made over the years, to what extent was it hampered during the COVID times, and especially looking at the past year, because there were concerns that many of the other conditions that are preventable and treatable, when it comes to their access, it was a bit limited. Looking at TB, how was it affected?
It was highly affected, and I can say we had a drop in 2020. In Nairobi, we had a drop of 3,000 TB cases, over 20%, because of fear. And I say TB was mostly affected because the presentation of TB and COVID is similar, because they all have a cough. So most patients were not coming. In fact, we had to put other strategies of how to get our clients by going to the community. So for us, it was really affected. Like last year, we only notified around 9,400 TB cases in Nairobi, and like our usual annual case finding of over 12,000 TB cases. So there was a major drop of over 30%. And we have come with other strategies to ensure now we are able to go to the communities and also to have targeted community screening and also self-screening of people who are not willing to come to the facility. Also economically, you can see people are affected. Most of the people went up country, they lost their job. So they didn't think TB was very critical for them to come to facilities to be tested. So we have a massive migration to up country, and this is also an area that affected even those who are on treatment. They gave the self transfer to up country. So these are some of the challenges that we really got during the COVID pandemic. Yeah.
All right. Now, remember, we're having a conversation about TB, given it's World TB Day today. The global theme is all about the clock is ticking, just trying to see what more we can do to boost the fight against TB in as much as we are in this pandemic. Bringing this conversation to Kenya, TB is the 5th leading cause of death in our country, and looking at the high burden counties, as per what Elizabeth has told us, Nairobi is among them, contributing to 15 to 20% of the infections when it comes to tuberculosis. And looking at the year that was so far, TB, of course, the efforts that have been made over time have been hampered due to this pandemic, because, everything came to a near standstill as we tried to contain the situation when it comes to COVID-19. But given it is preventable and it is treatable, there's so much more that we can do when we come together as a people to fight this particular disease. And we don't have to be losing people, because looking at world stats is that every day approximately 4,000 people die across the world. from TB. This roughly translates to 1.5 million deaths that can be prevented. And also looking at the efforts that have been put in place since 2000, it is an estimated 63 million lives that have been saved as a result of efforts that have been geared towards controlling TB. So today we bring this conversation here, trying to see what more we can do as a country, as a county, given we are among the high burden counties here in our country. And we still have Elizabeth Mweni with us, who is the head of TB programs and the NMS. Maybe, Elizabeth, you could tell us a bit about the treatment, looking at the cost of treating TB, it being a factor that maybe could be hindering most people from seeking treatment when it comes to TB. Is that something that you have seen that could be a problem?
Yes, and the National TB Program did a cost survey for the patient. You know, we don't want catastrophic cost to our patient if we want to end TB. So they did a catastrophic survey to see how much a patient incurs cost by the time they are diagnosed until the end of the treatment. So we saw for a normal TB, they end up even spending around between 2,500 to 6,000. But with the drug-resistant TB, which takes a longer period, a patient can incur up to 140,000 and above. So this is something that we came to realize, and you can see that we have a public-private partnership to ensure that we support facilities that in the private, to ensure that even when they give the drug, it's not too much cost, it's a subsidized cost. In our public facilities, testing for TB is free, and even the medication is free. We usually support the private facility to ensure that they have the package that is subsidized to our patients so that they don't incur this catastrophic cost. So patients should not worry. They need to come to us. We even have the new machine of testing, which the government and implementing partners are really supporting to ensure that we have free tests and medication in the public facilities is free of charge. So those are the milestones that we have made so far, and we are hoping that you are able even to go around to the private facility. You know, in Kenya, 48% of the facilities are private sector. So we need also to incorporate all the private sector to ensure that they give TB medication at a subsidized price, although we have engaged at least 50 to 60% of this private sector. Yeah.
All right. Now, I'd like to take you back to sometime June last year, 2020. We did see the CAS of Health, Rashid, under the authority of the Ministry of Health, come out with the policy documents to guide efforts in ending TB. By 2030, we shouldn't still be dealing with 2013. And consequently, the Kenya injectable free regimen treatment, as well as the latent TB infection treatment. What progress has been made with this particular guiding documents in line with also ensuring that treatment is accommodative of the bigger part of the population?
Thank you very much. We have already started with the injection-free medication, and this was being given to patients who had resistant TB, where initially we used to give them injectable, we used to inject them for 6 months. But after the policy document, currently we are using injection-free medication for our patients who are having resistant type of TB, and it has seen a lot of progress. We started last year. Most patients are doing very well. We are seeing even good adherence to the injection-free medication. Patients are really liking this injection-free medication. On the latent TB drugs that we are having, we are on the pilot, although most of the facilities are giving the latent TB drugs. We are giving for our HIV-infected clients to prevent them from getting TB. Our children that are exposed to TB parents or even TB people, we give them preventive medication to prevent them from getting TB. Healthcare workers are also in this category. They need to get a preventive medication for the latent TB infection. We are yet to do full blown for all healthcare workers. We are waiting for full commodity, but currently We are giving the people living with HIV, prisoners, and also children that are exposed to TB clients.
All right. Now, as we mark the World TB Day with the theme being the clock is ticking, how are we as a county and consequently as a country adjusting to this theme and just keeping up with the fight against TB? And maybe you could also give us or tell us a bit about the projects that are underway in line with this theme and what people can expect through the day.
Okay, thank you very much. This theme basically talks about it is us, the clock is ticking. As we get towards ending TB in 2035, we need, our president he was there in the United Nations meeting in 2018, and he committed to end TB by 2035. So we have the political will from our president, and we need county leaders also to commit to this. And we have seen a lot of milestones through resource mobilization and also resource allocation for TB in counties. In fact, all counties have allocated some amount to ensure that they are able to fight TB in Kenya. Ourselves, if you are having these issues of you're coughing, you're having night sweat, it is time. Don't wait until you are wasted. The time is today. Screen yourself, go to the health facility so that you are able to get medication. What we have in plan for you, because we cannot have a public gathering, I think the national event was cancelled because of the COVID era, but we are doing targeted community screening. We are going to the community to look for TB where we have high burden of TB cases. We are picking sample from the community. Please support us. When you see people coming and asking you if you're coughing, you have chest pain, are you having night sweat, have you lost weight, please support our initiative to ensure that you screen for TB. We are also screening healthcare workers. You know, we usually get these glands, and sometimes, most of the time, we neglect ourselves. So we are also screening healthcare workers for TB today. We are passing a lot of messages to the community, to the local radio station, just to ensure people are aware of how TB is how one can get TB, the signs and symptoms, how can you prevent, and above all, TB is treatable and preventable. So those are some of the activities that most of the counties are doing today to ensure they pass the message. We do targeted screening in the community and also screen ourselves for TB. Yeah.
And even as we wind up, maybe you had mentioned issues to do with stigma is still one of the problems that we are dealing with. As we go about the day when it comes to creating awareness and giving people the proper information, and given that health is a devolved unit, how then can, medics and even the county government come and help fill this gap to just help do away with stigmatization revolving around TB down at the counties?
Okay, thank you very much. I think stigma starts with ourselves. Yeah, we need to start with ourselves, talking more about TB, and we are doing a lot of health education at our facilities, but this is not enough. We need to do more at community level. We need to ensure that the community, but this has been done. I think stigma is self. What we came to realize, it's more of a personal issue, and we are talking a lot on this. When clients come to the facilities, we are doing a lot of health education. As you are going to the community, because we are having road shows going around the whole of this week, just to tell them about how one can get TB, and the people who have TB should not be stigmatized. It's an area that it will not end now, but with a lot of social mobilization and also awareness in the community, we are hoping maybe in a year or so, this is going to end and people will take it positively and support TB and support our TB patients, and we'll be able to end TB come 2035.
Absolutely. And maybe you could just, some clarification from one of our viewers this morning. She's called Kenzie. She's asking, when it comes to TB, does having TB in the past make a person immune to it? Clarification purposes.
No. TB is airborne. I want to say this. And most of us, I'll say most of us are infected, but we are not sick. We get the latent TB, but your immunity is the one that fights with this disease. Your immunity is enough, it can fight the disease, then you become okay. If your immunity goes down any way or another, you can get TB again, even if you had TB in the past, because TB is airborne. Yeah, we end up breathing, so that if your immunity is down, even if you had TB last year, you are prone to get TB this year. So I suggest that we try to boost our immunity, eat well. Lishe bora, it's very critical. Ensure that you're in a well-ventilated spaces, because with the well ventilation, we're able to dilute the air that has the concentrate of the bacilli. So once you get TB, it doesn't mean you cannot get it again. TB is airborne and you can get it again. So let's try to prevent it. Avoid overcrowding spaces. If you cannot avoid, ensure it is a well-ventilated area. Ensure you eat well, and you'll be safe.
All right. We also have a tweet from Suge, who's asking, from what you have seen, who is at the highest risk of TB infection? Looking at the age groups, I presume.
Everyone is high risk, but we have a population that are higher risk because of immunity. Our young children and the old. That's why we are giving children that are exposed to TB clients, we are giving them the preventive therapy because their immunity is very low and they are prone to get TB once they're exposed, because their immunity is very low. The old people, we know the old people immunity goes down. And as we look at the survey that we had in 2016, we were getting a lot of old people from the age of 65 coming down with TB. Then we have people with low immunity, HIV. If you're not on ARVs, you're at higher chance of getting TB because your immunity is very low. People who are also using immunosuppressive drugs, patients on steroids, patients who are on dialysis because their immunity is very low. In fact, you are giving them preventive therapy because if they get close to people who have TB, they are at higher chances of getting TB because their immune is very low. Diabetic patients, because their immunity is very low, they're also prone to get TB. Malnourished, people who are malnourished because you don't eat well. If you're not eating well, your immunity is not boosted, you're at higher chance of also getting TB. So those are some of the categories that are at higher risk of getting TB. It doesn't mean that the general population is not at a higher risk, but we have those that are at higher risk of getting TB because of low immunity in the system. So once they get infected, the bacteria will end up becoming a disease. It will just overwhelm the system and the immunity of this person. Yeah.
All right. And there's also someone who is seeking clarity when it comes to the difference between TB infection and TB disease.
Okay. Thank you very much. TB infection is now when, let me put it very simple. When you stay with the TB, when you're exposed to a TB patient, you are close to this person cough, you can inhale the bacilli. You have the infection, but you're not presenting the signs and symptoms, okay? I can say infection is more of the latent, the sleeping bacilli, you have it in your body, but your body will fight this disease, so you are not showing the signs and symptoms. You only have the infection, and this one can be done by you can take a test. Then when you do the test, like the IGRA test, the Mantoux test, we can see that the reaction is there because you have infection, but generally you are not sick. But TB disease is now when the infection now, the bacilli is going to multiply in your body. Yeah, then now you present with the signs and symptoms. The bacilli is multiplying. It's multiplying. You have more of the bacilli in your body, which cannot be capped by your immunity. So you end up presenting the signs and symptoms of TB. You are coughing, you are having fevers, you're having weight loss, you're having also chest pain. So you present with the signs and symptoms. This is the infectious type, and you need to be treated. With TB infection, it means you have just inhaled the bacilli, but you're not showing the signs and symptoms. Your immunity can contain the bacilli and you'll be well. Yeah, with this infection, because sometimes it wakes up when your immunity goes down one way or another, it can multiply. So this is the infection that we give the preventive therapy so that the few bacilli that you have in your immunity does not multiply. So we give you preventive therapy to kill the latent bacilli, but you don't present with signs and symptoms. You are not infectious. With TB disease, you're infectious because you have all signs and symptoms, and without treatment, you're going to die. So this is the difference between the latent and the TB disease. And with the latent TB, even when you do the test, you'll be negative, because the few bacilli are so minimal. They cannot have the signs and symptoms. But with the TB disease, when you take a test, you do the sputum for gene experts, it will be positive because the bacilli are very high and they are multiplying. I hope I've answered.
Thank you for that beautiful clarification. You just made it very clear for all of us to understand when you talk about TB infection and TB disease. It also goes ahead to just let them know that it is important to arrest it before it morphs to the worst, to the disease stage. Now, as we close this conversation, maybe your message to our viewers this morning as we mark the World TB Day, paying in mind to the fact that the clock is ticking when it comes to the fight against TB. Very briefly.
I want to say TB is treatable, TB is preventable. Yeah. Signs and symptoms of TB, please come visit any facilities and be tested for TB. It is free, it is treatable, don't suffer in silence. Yeah.
All right. Thank you very much for making time to speak with us this morning. We have been speaking with Elizabeth Mweni, who is the head of TB programs working with the Nairobi Metropolitan Services. As we mark World TB Day, pay mind that the clock is ticking and you as an individual are your first line of defense. So take charge, do what you can to protect yourself. That is that when it comes to that conversation. But first we want to switch gears, have a quick look at how our roads are doing this morning before we get to continue with the next discussion.